My name is Desiree King. I'm the owner of Senior Living 411 Incorporated. We do senior home safety inspections. However, all of our clients do receive, as well as part of the inspection, they receive a maintenance package, and part of that is they do get access to our concierge services, which saves them the trouble of having to Google or explore to look for different members of what different things that they need, and they can actually have access to our affiliates. Today, I'm happy to have Janice Gordon live with me. Janice is the owner and the CEO of Fresh Spring Spa. They are based in Brampton. One of the wonderful things about Janice is that she does do home visits as well, which is something that's very important to seniors, especially with mobility challenges and that type of thing. Janice is an OCR and an RCRT as well. And we're both members of Toastmasters as well. That's how we met. So I'm going to start with my first question. Welcome, Janice. What exactly is an OCR and an RCRT?
Okay, the acronym for OCR, Desiree, thank you for having me on this show. And I want to say happy Father's Day to all the fathers out there. OCR, the acronym for OCR is Ontario College of Reflexology Certification.
Okay.
RCRT is Reflexology Certified, and it's the acronym for RAC, which is Reflexology Association of Canada. So if anyone needs to know exactly what RAC constitutes of, they can always go into the website, and in that, if they type in Janice Gordon, they will see that I am the regional leader for RAC, meaning that I facilitate most of the training regarding reflexology.
Okay, so you're well stacked, very knowledgeable. Good to know.
Yes,
so before we delve into the nitty gritty on the 411 of what reflexology is and therapeutic massages for seniors, Janice, tell me a little bit about you. Who is Janice Gordon?
Okay, sure. Yes, my name is Janice Gordon, as you indicated, and I'm the CEO for Fresh Spring Spa Pain Management. Our services include hand, feet, ears, and head reflexology. We also do therapeutic massages, ergonomic assessment, lifestyle restoration, remedial exercise, self-care, and hospital discharge planning.
Oh, wow.
Our approach basically is to provide the highest quality services for seniors. Our clinic is located in Brampton, and the intersection is Bramley and Queen. Our website address is www.freshspringspa.com.
Okay. And I know for me, my life has led me through many careers, all of which seem to have intertwined into me ending up being first a senior real estate specialist, and most recently now a senior home safety assessment provider. So what is your story? What led you into getting into health and wellness?
Thanks for asking that question. My background has been in law enforcement.
Okay.
Started off first as a probation and parole officer. Then I moved on to a parking enforcement, then special constable and a constable.
Wow.
What led me, I liked what I was doing. Law enforcement is what I grew up in. My dad was a policeman. I've got other siblings and relatives who are police officers. But female in a male dominated environment can be very challenging.
Yes.
One has to basically prove themselves in terms of who they are, and basically saying that you are just as strong as your male colleagues.
Mm-hmm.
During my stint at the in law enforcement, I had some challenges, so I took STD and LTD. And the acronym for STD and LTD is short-term disability and long-term disability. I then went back to school. But before I went back to school, I was seeing a specialist who referred me to a reflexologist, and I didn't know what that was. So I thought, I will explore my options and see what it's all about.
Okay.
I fell in love with the course. I went on to do the course, and I'm proud to say that I'm a certified registered reflexologist. And I further went on to Oxford College to pursue massage therapy, which I finished in April of 2019.
Okay. Very in-depth path leading you there, and I can definitely appreciate that. Now, when I hear the term reflexology, I think of two things. I picture a rubber band bending and twisting, and I
Yes.
picture the reflex when the doctor comes and taps your knee with that thing to see if you're going to kick him or not. So, what exactly is reflexology?
Okay, basically, reflexology, it's basically a non-invasive treatment. And what that involves is more um, integrating and palpating the reflexes on your feet, on your hand, on your ears, and on your head. There is a difference between, there's a myth, I should say, between massage therapy versus reflexology. Reflexology specializes in understanding the reflex points of the related anatomy, whilst massage therapy specializes in understanding the anatomy. Also, with reflexology, you can come in with, we can do you with your clothing on. With massage, we have to do you without your clothing, you know. So with reflexology, we work on the small muscle. With massage, we work on the larger muscle.
Okay.
Reflexology, we use our thumb, we use our kneading, we use our fingers. Massage, we use the whole body, we use the elbow, and that's the difference between reflexology and massage.
Wow. Okay. Very intriguing. I remember, like I said, we know each other from Toastmasters. We're both members of Toastmasters International. And I remember you once did a speech where you showed us a diagram of the foot and how important our feet, I think, are the one of the most deprived things in our body. And it's actually like our root for our body. And I remember you showed this diagram of how many different illnesses, I guess, or different things your feet are attached to that can go wrong with your body. Can you tell me some of the things what do your feet really say about your health?
Good question. Your feet is actually the blueprint of your body. I do have a picture here that I can show you.
Yes.
And you can see the heel is the pelvic area. Between the heel and just here is the abdominal area, where the yellow section is, that is the chest or thoracic area. And just below the toe baselines, just about there, and that's the head. So this is just a simplistic diagram showing you how the body is actually segmented into 4 sections. So if you need to work with, let's say someone is having problems with their back, so then we will work on the spinal reflex, which is actually here.
Oh, wow.
The spinal reflex is the inner part. You know, your sciatic nerve as well too, we'll be working on the heel area.
So when you say working on the area, are you actually massaging that area, or
that's right?
Foot,
yes.
If your foot is, I have a thing about dry feet. So if your feet are too dry, does that symbolize something, or how in depth do you look into the foot of a person?
Well, before you actually start any treatment,
yes,
you have to do an assessment.
Okay.
And assessment entails, you know, cleansing of the feet, of course. You know, you are looking for any pathologies such as fungus, open lesions, athlete feet, feet, you know, those are some of the things that we would be looking for. And with that being said, we will make notation, you know, in terms of our observation on your medical chart. Dry feet usually comes from dehydration, lots of lack of water and the absence of water, not only on your feet, but it will also show on your skin, your face,
Right.
also show on your hand and your entire body.
Okay. And I know you also do hand reflexology. Does your hand tell a story as well? And if so, how can you detect what's wrong, I guess, with your hand?
You know, yes, your hands do as well too. I don't have a diagram with me with
Okay.
hands, you know, should have worked with that.
You
But
can feel free to post it in the group after. I'm sure people will want to know. So just post it
absolutely.
and we'll go
Yeah,
ahead. Go ahead.
absolutely. As we age, we actually we have a tendency of folding our hands. There are some basic techniques that you can do to eliminate your fingers coming this way. You fork, hold the finger, you squeeze, and you pull. Again, you fork at the base, squeeze, and you pull. Then you do some compression with the thumb. You're just doing some like sort of circular,
Right.
and you're pressing as you're going along. You're squeezing.
Mm-hmm.
And these are called compression squeezing. It
Right.
really helps the hands. You can also stretch the hands by just holding it up, taking the other hands over, and you pulling that.
Right.
Your diaphragm area, your stomach. So you always stretching that. You will always find me doing that, looking at TV or speaking to anyone. I always encourage people to always keep, you know, doing their fingers because we want to eliminate as we age, you know, we want to try to decrease that
Right.
and
Now,
increase mobility as
and
well to our
increasing.
fingers.
No, I agree. I have this thing now as I've gotten older. When I get up in the morning, I have this one finger that's tight. I can't bend it until the day
Yes.
goes along. So maybe I need to come and see you and we can discuss what's happening because it's really weird.
Sure.
But
Sure, and some of the basic exercises I just showed you, you can
yeah,
also try working on
can
that as
work on that as well. I'm going to start doing
yes.
that. But
Okay.
when we speak now, let's tie this all into the benefits for seniors. So when someone is aging, they go through, especially if they're not that mobile, they go through a lot more tightness and stiffness, I guess. So what are some of the benefits and what type of services do you offer to seniors in
Okay.
particular?
Yeah. Well, we do a home care, specialized care with clients who have injuries or being discharged from the hospital. We will come to the home, you
Okay.
know, but it's always preferably if the client can come to the clinic because all the tools are there. But
Yes.
in the event that that is not possible, we will come to you. And the benefits of that,
Right.
it improves the condition of your skin, it improves circulation, it increases mobility, and that is what most seniors are looking for, getting back to that normalcy, you know, getting back to that independence. It also stimulates the nerve endings, reduces stress and anxiety because let's say, for instance, you had a hip surgery or knee surgery, the fear of the unknown. Will I be able to walk? You know what I mean?
Yes.
So we try to we decrease that anxiety, relieve any sort of muscular fatigue or tension, create an overall well,
Right.
you know, yeah.
And is there I know I met a client the other day and the first thing he mentioned was arthritic pain where the top half of his body was okay, the lower half wasn't. And it felt good that when I was there for the assessment, he said, you know, it would be great if I can have someone come over because I know I'm not moving enough and help me. And it felt good off the top of my head to say, yes, I know someone and
Yes,
be able to
yes,
make that referral. So
yes.
when you come and his biggest concern was when you come, he didn't want a blanket statement because people hear a massage and they think, okay, I'm going to get a massage. He didn't want a blanket fix because his situation was unique. So is your approach when you come and visit the senior, I guess, to kind of do an assessment and then develop a plan around the person? What
That's
their
right,
needs
exactly. Yes, that's what we will do, you know, come in, you know, try to understand where the client is coming from. Then
are.
we will do a treatment plan. And
Okay.
I will go through the treatment plan with the client and there we will move. And throughout that treatment plan, I always incorporate home care exercise, because that is very important, especially for arthritic. Any sort of arthritic, you need to start to work the muscles, the tissues,
Yeah.
so that you can get back to normalcy, and also increase mobility as well too.
Wow. And on average, how long is the session when you come to the home? On average, how long is the session for?
Again, it all depends on the severity of the client and the chronic pain that they have. If it's an
Right.
acute pain, meaning an injury that occur between 8 to 24 hours, then you don't want to traumatize the body. So you will actually do 30 minutes. If it's
Okay.
something that it's chronic, then we will do 40 to 45 minutes with some exercise incorporated
Right.
in that.
Right.
Yeah.
Okay. And are your services covered by OHIP or do you accept medical plans? How is this all covered?
No, not OHIP as of yet,
Okay.
but we do take Green Shield, we take SSQ insurance, RBC insurance, and we're working on the other like Manual Life,
Okay.
Waitress Life, Sun Life.
Life.
Funded just before the COVID. So when I get back there at the end of the month, I will see exactly. So I will say tentatively Sun Life, because they
Okay.
are actually very happy with the services that we are providing.
Okay. And I guess I can see you have a passion for what you're doing, and that's why I seek out people who are like me and have a passion for the work that they do, especially when dealing with seniors, because they are often, and we've seen it through COVID especially. It's one of the reasons that have led me to kind of more focus on home safety, because we've seen what's happening with our seniors during COVID. They're the ones that are passing away the most. They're often more neglected. So I love people who have a passion. What is it that really, what brings you joy in doing what you do?
What brings me joy when I see that gratification on the client's face, when the client come in bending forward and they're leaving the clinic with a straight back.
Uh, yeah.
So that brings me gratification
Wow.
to see, from
Yeah.
they came in when they were down and they're leaving
Yeah.
elevated.
Right. And I'm guessing the length of time that one would have to get a therapy, it varies based on the severity of the injury or of the condition that they have, right?
Correct. Yes, indeed. Yeah.
Okay. And do you leave them with homework? So you come by for say 30 to 45 minutes. A lot of people have caregivers who come by the home, private caregivers who come by to help them out with cooking, cleaning, that type of thing. But they also can help them as well with exercise regimens that are left for them. So do you leave homework, so stuff that they can do on their own as well?
Yes, I do. And that is the exercise component. And
Okay.
that is basically it's just some basic exercise. You don't have to go out and purchase anything. Two
Yes.
bottle of water. That's all you need. Two bottle of water. And
Okay.
just stand up, you stabilizing yourself, and you just,
Oh, wow.
yeah, you know what I mean? Just two bottles of water. And any exercise that I show you, it's basically you have to always stabilize yourself, holding on to the table or holding on to the chair,
Hmm.
for stability.
Right.
There's some people who are able to do it without holding on, but those who are not, I always encourage them to stabilize before they start any exercises as well too.
Right.
Diaphragmatic
Right.
breathing is also very important. You breathe in through the nose, you hold it, and then you bring it out through the mouth. That is
Right.
very
Right.
air passage in the lungs.
Hmm. Okay, lots of valuable information. Again, if you're just joining, we are talking about the 411 on reflexology and therapeutic massages with Janice Gordon. She is the owner of Fresh Spring Spa located in Brampton. However, she does do home care as well. Just to touch on the massage aspect. Now, when you say therapeutic massage, I've had hot stone, I've had aromatherapy. Is it that type of massage, or is it something more in depth than that?
I do more, I don't particularly like the hot stone massage. So I do just regular massages where, let's say if you're coming and say you've got some tightness,
Right.
you know, in the upper back or in the rhomboids area. So I start off by warming, shaking the feet, then I will effleurage, warming up the tissues, and then I start to work on the specific area that
Okay.
you have the concern. Yeah,
Okay. So it's a more advanced level of massages
it's
than.
not, that's right. Yeah. Mhm.
Okay. Okay. Um, Without mentioning names, can you give me an example of a success story, share a success story with us of client A or client B, how they came in and how they left after X amount of time?
Yes, I absolutely. Yes, there is a client, client J, and someone told her about me, and she came in around February. She had a lot of complaints in the sciatic area and
Hmm.
rhomboids. The rhomboids is more on the upper part of the back. So
Right.
she was complaining of a lot of tightness there. So I give her, she was scared. It's the first time having a massage as well too. So I said, I'm gonna go light and then I'm gonna go semi deep and then go deep. But then I work with your tolerance base. If
Mm.
it's too painful, then of course, I will ease up and I go middle and then I go like light is always, I find it's more for fragile
Hmm.
or seniors who are more fragile. Medium
Hmm.
to deep is for clients who have a very high pain tolerance. So
Hmm.
she came in, she was kind of scared and nervous. So you have to sort of reassure the client and let them know we're working together as a team. So you
Right.
let me know what your pain tolerance is, and then I will scale back. So when I finished, she was so happy and relieved because she came walking Ben and she was able
Wow.
to sit up with erection, where the back was very well erected. And
Yeah.
she keep calling from the time COVID came and when are you coming?
Yeah.
So I said at the end of the month. So she's my first client when I get back
Right. Right.
to get some sort of services in terms of
Okay.
fee for her back.
And since we've mentioned COVID, when do you get back to work, or are you back to work right now?
I'm going back at the end of the month, end of
End of the
this
month.
month.
Okay.
Yeah.
And I guess I will ask, because a lot of people are probably thinking, what type of precautions do you use for COVID when meeting with a client? Are there government regulations? Um,
Absolutely. That is
okay.
paramount. We have to be in compliance and
Yes.
we have to also adhere, to what the regulatory bodies has told us. Sanitize every time the client leave, you sanitize, you wipe the reception area, you change the towels, you change the linens. And I also just created a checklist in terms
Mhm.
of, have you traveled? Do
Yeah.
you have any serious cough, shortness of breath? So every client that comes in will have to fill that questionnaire.
Okay. So you are safe as well. That is
That's right.
definitely of
Mhm.
paramount
We will be
importance.
wearing masks as well too, and I
Okay.
will be using gloves to do
Okay.
the massage as well too. Before you use your naked hands, so
Yeah.
COVID-19 has changed. So basically, you have to be using gloves. But people ask as well to using the gloves, would it be the same? But the gloves that you use, it's very
Hmm.
effective in the sense
Hmm.
that when you touch the skin, you think the client will feel as though you're using your raw hands.
Okay, that was a question I was going to ask, because I know my mother-in-law, she's in retirement residence, and she
Mhm.
asks the ladies, the PSWs who come in to change her and stuff and bathe her, if they can massage her. And PSWs are not allowed to rub, so they have to wear gloves. And
Mhm.
she doesn't like it because it doesn't feel the same. So whenever she sees me, I give her a real rub
Good
down with
rub.
my naked hand. So
Yes.
that was my next question. Is it as
Yeah.
effective as opposed to the naked hand with the gloves? But you
Mhm.
actually went on to answer that, because that is a concern. It's like getting
Yes.
someone to scratch you with gloves on. Is it the same?
That's right.
I don't
Yes.
know. Because when you
Yes.
have a good itch, you want to feel the, the nails and stuff. So it's good to know
Exactly.
that you do that.
Mhm.
Just one little thing I want to touch on as well is swollen feet. I know that's a
Mhm.
huge thing for seniors. I've seen clients whose feet are really swollen. they're on water pills and stuff sometimes to reduce the water buildup. How do you have any treatments for that type of thing as well?
Swollen feet, you know, sometimes it can be standing too long on a long fight, poor circulation.
Mm-hmm.
Rest is the key.
Okay.
You sit, you elevate the leg.
Okay.
Elevating the leg is very important. Stretching the legs, like, you know, you can sit down and you flexing the feet so the toes are coming back and then forward, and then you rotating, then anti-clockwise. You know what I mean?
Right.
Massage as well too, we will do as well too, which is called the lymphatic drainage. So the lymphatic draining is between the big toe, different lymphatic drainage point, one on the instep of the feet or between the big toe. So you sort of do some compression, right? You just keep doing the compression,
right,
and release, you know, and then do light massage. And then, yep, they will find they'll be going to the water, eliminating a lot of water. And that's part of it because it's water retention. But even sometimes when you take the water pill, you become very dehydrated. So you need to compensate, you know, all that water that you've excreted, you need to replace that back as well too. So, you know, you just have to manage that and balance your water consumption.
Right. Wow. Well, you know, we've been on the call already for about it's 7:28 for half an hour already.
Oh, yes.
Time runs when you're having fun.
Yes.
It was definitely great speaking with you, and we definitely have to probably continue this conversation, probably touch on some different topics. But again, my name is Desiree King. This is Janice Gordon, from CEO of Fresh Spring Spa. Janice, can you tell our viewers once again how they can get in contact with you, your website, your address, your phone number? Share with them how they can get in contact with you.
Absolutely, yes. My website address is www.freshspringspa.com. My location is Bramley Medical Building, 18 Kensington Road, Suite 304, Brampton. And I can be reached at 647-542-6251. Again, awesome. 647-542-6251.
Great. You know what? Another question popped into my mind really quickly. As you know, I do fall prevention. What are the benefits from massage and reflexology, as far as, nothing is foolproof, but as far as helping to prevent an older person from falling, as far as balance and that type of thing?
Again, that ability and coordination.
Yeah.
That is like, I have to come in and assess to see exactly the extent of the fragility of that client, and then sort of offer some exercise that they can use, because as we age, we also lose muscle mass.
Yes.
That is what sort of creates that imbalance, because we don't have the strong muscles to stabilize us.
Right.
Yeah.
Okay. Awesome. Well, thank you again. For those of you, again, my name is Desiree King. This is the Senior Living 411 series. I air a different guest speaker every 2 weeks. If you need to reach out to me, my website address is seniorliving411.com, and our toll-free number can be found on the site. Once again, my name is Desiree King, and have a blessed day.
Thank you very much for having me, Desiree, and I look forward to joining you again.
Thank you, everyone. Bye.
Thank you. Thanks.